We will be going over unsafe methods in phlebotomy. It is apparent that the phlebotomist has to turn around, twisting her spine in order to grab the materials needed for the blood draw. This can cause injury to the spine over time. Additionally, the phlebotomist is hunched over her patient, causing an overkyphotic curve of the thoracic and cervical spine. This posture, if maintained for long periods of time, can lead to musculoskeletal disorders such as chronic pain in the lower, middle, or upper back. Finally, it is important to keep your workspace clear, as trip hazards can cause falls and injury to the lower or upper extremity. Here, the phlebotomist almost tripped over the table riser. So be sure to check your surroundings before beginning a blood draw procedure. Now we are going to be talking about the safe methods to do the same task in phlebotomy, collecting specimen samples. First, the phlebotomist moved trip hazards out of the way, and she is raising the adjustable table in order to accommodate for her height. Now that the phlebotomist has raised the adjustable table, she is able to stand while performing her job in an upright posture, which is much safer than the downward posture that she had previously. She is also moving her materials closer to the patient so that she does not have to twist and turn around in order to retrieve them. This will allow for safer practices over time, and the phlebotomist is protecting her body by practicing these safer methods.
Here, the phlebotomist is engaging in unnecessary twisting and bending of the spine while retrieving items to apply patient labels. This can lead to chronic back, neck, and shoulder pain, as well as a kyphotic posture and stiffness over time. To promote good posture and prevent injury from unnecessary reaching and twisting, the phlebotomist placed all needed items together within reach and used a chair with a lumbar support to sit while applying patient labels. Another alternative, if a chair is not available, is to again place all materials together within reach and raise the table to an appropriate height to reduce the need to bend over. This will reduce the risk of spinal injury and chronic pain of the back, neck, and upper extremities over time.
Here the phlebotomist is seated on a stool instead of a chair with ideal seat dimensions and lumbar support. The stool height does not allow her feet to reach the ground. She has to twist her torso to reach the light. Because she's not using a surface to position her computer at an appropriate height, her neck and thoracic spine are flexed to a position that will create pain, her head is in forward posture, and her shoulders are unnecessarily internally rotated. The phlebotomist's wrists are also flexed instead of near neutral and left unsupported. This positioning could contribute to conditions like carpal tunnel syndrome. Here the phlebotomist is seated on an adjustable height desk chair with her lumbar region supported and feet on the floor. Her body is positioned close enough to the surface her computer is on that she's not leaning forward to type, avoiding flexion in the neck and thoracic spine. Her wrists are comfortably supported by the counter and held in a neutral position.